Hey, I'm Taylor, and today I'm going to be talking about what hypothermia is and how to prevent it. So, hypothermia is when your body loses heat faster than it can produce it. So, if your body drops below 95 degrees Fahrenheit, then you're going to have hypothermia. So, how can you develop hypothermia? You're going to develop hypothermia when you're in really cold climates and you're not really doing anything to warm up. So, what happens is when your body temperature drops, your heart, your nervous system, and a few other organs aren't going to be able to work properly. So it's important to get treatment because if you don't, it can eventually lead to death. So hypothermia is most often caused by exposure to cold weather or immersion in a cold body of water. I'm sorry. So some things that you should consider wearing would be a toboggan, maybe some big thick socks and a jacket. It's really important to layer up. So with all of this, I would even wear like big fuzzy boots like Uggs or something like that, and I would wear long sleeve shirts and some gloves, but I don't have any gloves. So there are 3 different types of hypothermia, and that's mild, moderate, and severe. So moderate and severe kind of go hand in hand with each other. So the symptoms for mild is shivering, dizziness, hunger, nausea. You're going to be breathing faster, trying to produce some heat. You may not be able to speak right. You may have some confusion, lack of coordination, fatigue, and your heart will be racing. So moderate and severe, you're going to be shivering. You're going to have a lot of lack of coordination. You're going to have slurred speech. You're going to feel drowsy. You're going to have a really weak pulse. You're going to start breathing really slow and shallow. So, obviously some causes: wearing clothes that aren't right for conditions. So, if I was going into like a snowy area, I would definitely not be wearing some kind of short sleeve shirt because I'd be freezing. So, if it's snowing, you really don't need to stay out that long because your body is going to be freezing. If you fall in a body of really cold water and you can't get out, not enough heat in your home can cause, especially in elderly people, because they get really cold really easy. So how does the body even lose heat? So there's radiated heat, which is unprotected surfaces of the body, direct contact, and wind. So a few risk factors are the elderly, because like I said, they get really cold really easy, like babies and infants and toddlers, because they can't really stay warm either. And people that have some mental problems or who are battling alcohol and drug abuse. A few medical conditions can cause it, and a bunch of medications. So some treatment that the doctors can do, they can start rewarming your blood, and they can do that through like have you ever seen like a kidney machine, how they filter your kidneys? It's kind of like that. They can run warm fluids through an IV to try to warm you back up, and they can use irrigation. So prevention, you just need to be able to cover up and stay in layers. You need to be able to stay dry. Try not to go in really cold bodies of water when it's already cold outside. And you need to avoid activities that overexert your body. So the main thing with hypothermia is the fact that it's when your body cannot reheat. So if it can't reheat, obviously our body isn't, like our organs and stuff, is not going to be able to do anything about it, and they're going to start shutting down. So if you notice any of these symptoms or anything, then you need to call 911 as soon as possible for your loved one. Thank you.